dental. This was really interesting, and some people noticed that dental codes were taken out of the HCPCS. It says, Mark says, hi, I noticed D codes or dental are no longer published in the HCPCS for 2013. Since I do not use D codes, this is the first time I noticed. I did some Googling, and in 2011, they were no longer used in HCPCS. Am I correct or wrong? Well, it's a very interesting story, guys. It is true. They took out the D codes or dental coding codes out of the HCPCS. Um, and wow, I'm trying to remember. Yeah, it was 2011, I guess. So where did the dental codes go? They didn't go anywhere. They're still out there and they're still being used, but they're not allowed to use them in the HCPCS manual anymore because of a copyright law with CMA. So the ADA uh, is the American Dental Association. They more or less came in and said, and there's the article that explains it in depth. The ADA.org explained that most these are our codes, and you're not allowed to publish them. So that went into effect. I think that's the May 24th, 2011, as part of an updated licensing agreement between the CMS. The ADA dental codes will no longer be available through downloadable healthcare comments. So, in other words, it's like the CPT coding manual. It's a copyright written book by the CMS. No, nobody. You'll only see it in one version. Same thing with the dental codes. But if you go into find a code, you can find the dental codes, and they're still there. You can't find them in Supercoder. They're not in there, and you're not going to find them in the HCPCS book. Now, there's a link. I think if you go back, I put a link on there for. Okay, there. Find a Code had them, and I just pulled out a couple of them. Preventative. Did it? Yeah, I think if you click on that, I don't know if it's going to take you. Yeah. Will it take you to that or not? Yeah, there you go. Uh, D, let's see, 1110. It tells you what the preventative medicine for prophylaxis, which just means making sure they don't get, you don't get sick, more or less, getting a flu shot as a prophylactic um, treatment. And same thing with going in and getting your teeth checked as a child or an adult. Those codes are still there. You can purchase the dental code manual from the ADA, or obviously Find a Code has gone in and done something that allows them
Yeah,
to do it.
the Find a Code people pay a license fee to the ADA, and so when
Yeah,
you pay for your Find a Code subscription, it'll give you access, to that.
right.
Probably the same with Supercoder. We probably just in our account don't have access to it.
Yes, or I just didn't know the proper thing to put in there to look it up either. But again, that's why they're not in the HCPCS. If you get an old HCPCS book, they're there. So those are your examples of those codes. Now, when I was doing this research, though, I did find this some comments on the AAPC forum about dental coding, and this was a really interesting code that 41899, and they stated this is an unlisted procedure code for surgeries performed on the teeth and adjoining structures. Okay, so in other words, when they go in and they actually do a procedure, but there's not a dental code for it, you can use this code to do that. But, and I found this information in Supercoder when I looked it up. Now, if we scroll down just a little bit, but there was a tip, and this goes back to what Laureen will tell you in the lectures. When you report an unlisted code, you better have documentation to back it up. That's a red flag for everybody using an unlisted code. So what you want to do is to make sure you submit a cover letter with the claim, and whenever possible, do the op notes. Any relevant documentation needs to go in, because they're going to pull that, they're going to review it, and on a case-to-case basis, they said, to make sure that that code is allowed to be used. So keep that in mind, not just for the dental coding, but anytime you use an unlisted code, which ultimately is just a kind of a not, I don't want to say broadband, but a code that kind of covers a lot of stuff. You do want to have documentation to back it up, and you might as well send it in with the claim. Don't let them reject it and ask for it. Uh,
We're
that'll take too much time.
we're getting a couple comments in the chat that people are running and checking their HCPCS book, and they're like, I've got dental codes for 2013. So I'm wondering if they worked out a deal for
They maybe did, but I know that
2013.
12, I'm pretty sure 12 didn't have it, and I
Right.
think 11 didn't have it either. Uh, because when at the college, when we actually taught dental coding, and they had all these, workbook exercises, and they couldn't get the code. It wasn't in the code books. So that we'll have to follow up on that and see. That's interesting. And again, this was probably a big brouhaha. And then as the years have gone by, they've found out ways to make their money, and be reimbursed for those codes, for the use of um, compiling those codes for you, I guess is a way to say that. But HCPCS is very interesting. It's not used, a whole lot, but it is used um, quite a bit, especially if you code with people who are over 65, Medicare patients and stuff like that, and use a lot of HCPCS codes.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.